Assembly Member Russell.
Just very briefly, central and inner London boroughs have very low car ownership levels, about 30 or 40%. Do you agree that car share services enable these very low levels of car ownership?
Yeah, car clubs have been transformative in terms of people making the choice not to be a private car owner, but to use car clubs, and that's why we worked really hard with Zipcar as a private company to try and keep them in London.
Thank you. Thank you.
Chairman, can I
Assembly
just...
Member Hall.
Thank you. I just want to make a comment. It's really good when Labour Assembly members ask proper questions of the Mayor. Clearly he doesn't like it, and of course he's surprised again. Whenever the Mayor is surprised, it means he's getting a question he doesn't like. Fair enough.
Nice try, Baroness.
I think we got the gist.
Thank you. Thank you so much.
You can come back if you want, Mr.
There's no time left for them.
Are you fine?
There's no time. They've run out of time.
Well, you can address
She's
me.
not quite a Baroness like you are, Lord.
You can address me.
Yeah.
Sorry?
What's the question?
If you just want to say something, then...
Not at all, not really.
OK, all right then, fine. Well, look, OK, right, let's get back on the next question after that, which is... So we're missing some questions, Mr Mayor. They've been withdrawn. We're now moving to the question in the name of Assembly Member Irani, COVID Inquiry Report Phase 2.
I thank the member for his question. The COVID-19 pandemic was an unprecedented crisis that continues to affect Londoners, with many still feeling the repercussions on their health, jobs, relationships and education. This public inquiry is of vital importance for those who lost friends and relatives in the pandemic to get answers, and for London as a city, as well as to the whole country to improve our resilience to future emergencies. I was pleased to give evidence to Phase 2 of the inquiry and welcome its report. The Phase 2 recommendations are directed almost entirely at central government. Nevertheless, the London Resilience Unit and my health officers are reviewing the recommendations for any learning that may be relevant to improve London's partnership preparation and response to future emergencies. Local learning from COVID-19 has already been incorporated into London's response processes. In November 23, the London Resilience Forum approved a disease-agnostic pandemic response framework that incorporated early learning from the pandemic. This framework sets out the triggers, roles, responsibilities and actions of all the relevant partners to respond during a pandemic. From 15th of September to 5th of November this year, the GLA participated with other key partners in a cross-government pandemic planning exercise called Exercise Pegasus. The exercise was intended to test decision-making and preparedness to respond, collaborate and communicate during a pandemic caused by novel infection. The government's pandemic framework has not been updated since COVID-19. This will happen once the learnings from the exercise have been identified. This means that the exercise wasn't as useful as it could have been to help with local planning. However, London took as much benefit as it could from the exercise, and the London Pandemic Working Group will be considering further exercising that is better suited to London. We're gathering the learning so far from the exercise, and when we receive the National Debrief Report, we'll incorporate its lessons into our resilience and response processes as usual.
Thank you, Mr. Mayor. I'm glad to hear that we are taking the learnings from a London perspective for future as well. But one of the things that the inquiry also found was that ministers and senior officials undermined public confidence by failing to adhere to their own rules. In fact, it was a major issue here also at the London Assembly as it later unravelled. What reflections do you have on the importance of maintaining integrity in public office?
Well, I was hoping Lord Bailey maybe had to give us a personal experience of this issue. I'm a believer in the Noland standards in public life. He'll be aware that one of the reasons why I suspect support dissipated from a former Prime Minister was because his clear sense of law breaking. I think lawmakers definitely shouldn't be law breakers. And that had a huge impact on not just public's confidence in the previous government, but when you speak to bereaved families and families who couldn't attend funerals, families who couldn't celebrate weddings, young people who were affected in terms of following the social distancing rules, the impact on them, and then you compare and contrast how lawmakers are breaking the law is a real issue, and it is also of huge concern to me. When I read the report, the conclusions that had lockdown begun a week earlier, and I was calling for it, 23,000 fewer people may have died. Now just think about that. There are 23,000 families grieving the loss of a loved one, which may not have been the position had politicians heeded the advice from experts and advisors.
Thank you, and I hear that point loudly in the constituency I represent across Brent. Two areas in particular, Alperton and Churchend, were severely impacted in that first phase of the pandemic. But the pandemic also led to a rise in vaccine scepticism. And in London, we have the lowest childhood vaccination rates in the country. What message do you have for people in public office who peddle irresponsible anti-vax disinformation?
There's a phrase which I wasn't aware of until the pandemic began called vaccine hesitancy. These are people who are hesitant about taking the vaccine, and some of them were for understandable reasons. In their country of origin, they may have seen pharmaceuticals acting inappropriately when it comes to testing pharmaceuticals. But also some of them on social media were seeing people, amplifying anti-vax messages, a lot of them lies, and they started believing that. And so we had to spend a lot of time trying to address the myths and, frankly speaking, the misinformation to give people the confidence to have the vaccines. Look, vaccines have saved lives for decades, and they will save lives going forward as well. In terms of this particular pandemic, there's no doubt it saved lives, and so it is really important we address the issue of disinformation. I'm a firm believer in not engaging with conspiracy theories because you give them the oxygen of publicity, but there's a role to play for respected message carriers to educate in a non-patronising way and to give people confidence about the importance of vaccines. They are lifesavers.
Okay, and the NHS is under huge pressure this winter, and flu cases have started at a record high this winter. Data released actually just moments ago have shown that the rise in London is not as steep as they expected, but the NHS must stay on high alert because in the past you have seen waves come forward in future months. And with this being in the news, people have been obviously impacted by it, and it's in a lot of people's minds. Pharmacies are now actually reporting that the amount of people taking up the vaccine in the lead up to Christmas is far higher than it was or usually is this time in usual years. So can you ensure that your public health team is working with the sector to ensure that London doesn't run out of vaccines and has what we need?
Yeah, great question. My advice to any Londoner and anybody across the country who's eligible for a flu vaccine is please take it. I took mine a few weeks ago, and it's a game changer in terms of the impact when you're a target for the flu, and it's really important that people who are eligible for the vaccine receive it. My understanding from the briefing I received recently from my public health advisor and the NHS was we've had the peak flu this year earlier than is otherwise the case, which is good in a way because we won't see, hopefully in January, issues in the NHS when it comes to capacity as inpatients. So fingers crossed, it's good news for us that the peak has come earlier. But he's spot on in terms of keeping an eye in terms of vaccine availability. The good news is so far we've got good coverage in London. And by the way, this is a nice problem to have, the fact that people have been more keen to get the vaccine as well. I've not checked in the last 2 weeks, but I'll check after this meeting to make sure we've still got coverage. What we can do is sometimes get vaccines from across the country in London if there's a particular need for that. Let me follow that up. I'll make sure we've got the confidence to Londoners that pharmacies, GP practices and others can provide the vaccine.
Thank you, Chair.